Hello, my name is Vanessa Garcia Gonzalez, and today I will be doing the tracheostomy care video. Before I begin, I have all my supplies right here, which include a pair of clean gloves, tracheostomy sterile kit, hand hygiene, my hydrogen peroxide for any secretions that are crusty or stuck, and my saline solution. So now that I have that, I'm gonna go ahead. Oh, I have my provider's orders as well as pieces of tape right here pre-cut already. So I'm gonna go ahead and begin by knocking at the patient door, providing privacy, introducing myself to the patient. Hi, my name is Vanessa. I'm gonna be the nurse taking care of you today. And then I'm gonna go ahead and confirm name and date of birth, double check with my double identifiers, which I have confirmed I'm with the right patient. I'm going to explain the procedure to the patient, let them know how long it's going to take, see if they have any questions, and also let them know that if at any point they feel any discomfort, just to raise their hand so that I could go ahead and accommodate. I'm going to go ahead and start off by raising the bed to appropriate working position for myself, elevating the head of the bed to about 30 degrees unless contradicted so. I'm also going to make sure that I have a set of vitals, a cardiopulmonary, and make sure that my patient has a continuous O2 on him the whole time. Once I have done that, I'm going to go ahead and apply some hand hygiene. I'm also going to make sure that my patient is pre-oxygenated for about 30 seconds or so, and have them take a couple big deep breaths in right before I take off their nasal cannula. Okay, which they have done so. And I also have on standby the suction in case it is needed. Excuse me. I have used these gloves a couple of times. Okay, so nasal cannula on standby. I'm going to remove the oxygen. And once I've done so, I'm also going to remove the soil dressing. Like so. Dispose of that, dispose of gloves. I will now then apply hand hygiene, and I'm going to go ahead and start by opening up my sterile tray. So for this, I'm going to make sure to open it away from me. I'm going to pull out the pair of sterile gloves and put them on the side. I'm also going to pull out the sterile dressing, and I'm going to make sure I'm only handling the shiny side like so, and I'm going to place it in front of me. Perfect. Now that it's in front of me, I'm just moving it so it's nice and safe. I'm going to go ahead and grab my tracheostomy care supplies, and I'm going to throw them right here on the sterile dressing. I'm going to place this on the side, and I'm going to go ahead and add in my saline solution to the three sides, and as well to one side I'm going to add my hydrogen peroxide in case I need it. I'm going to go ahead and move things around just so you can see me apply my gloves. I have limited working space, and then I'll move things again. I'm going to go ahead and apply my sterile gloves, making sure that I am only using like the indicated like little ridges. Make sure that it's nice and open and it doesn't close. Working with a 1-inch border and making sure that I'm working from a waist above to make sure sterility. I'm going to grab the cuff and apply my dominant hand first. I'm going to grab the inside of the cuff and apply the other set of gloves. I'm going to go ahead and move this out of the way. I just tossed it, please. I'm going to go ahead now and bring this to a working position where you could see, and I'm grabbing my sterile supplies. I would not cross over my sterile area, and I'm going to go ahead and just organize these things a little bit so that they're nice and easy to work with when I need them. And I'm also going to go ahead and add my tips to the saline solution to soak. Now that I have my area nice and organized, I am going to go ahead and take off. I'm going to adjust the patient to camera view while not breaking sterility, just so you could see. Okay, perfect, like so. So now I'm gonna go ahead and begin by removing the cannula out of the trach. So I'm gonna unlock and following the curvature, removing out. I'm gonna place this into the saline solution to let it soak. Again, I don't wanna cross my sterile area. I'm gonna grab my brush, grab my cannula now that it's soaked, and I'm gonna go ahead and scrub. Once I've scrubbed, I will dispose of this. I will put this back and let it soak again. Take it out once it's already soaked and let it air dry. And once it's dried, I will place it back in, following the curvature. So now I'm gonna go ahead and grab my key strips and I'm gonna clean around the faceplate stoma of the tracheostomy. Dispose, 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 dispose. Now that I have done that, I'm gonna grab now my gauze and pat dry everything. Okay, now that it's pat dry, now it is time to change the dressing. Now it is time to change the tie. So for this, I would bring my other assistant to come and assist me. So I'm gonna just go ahead and scoot things around just so you could see me again. So I will have someone holding the trach in that position while I untie. Okay, now that that's untied, again, someone's holding it for me. I'm gonna grab mine and always making sure I'm working carefully that the patient is not in any distress and observing the hand motion. I also have my suction on standby as needed. And as I'm putting this on my patient, I'm making sure that it has no folds or twists because that can cause discomfort to my patient. Okay, and I will be using a single tie method technique. Excuse me, I'm gonna go ahead and just turn it slightly. Perfect. Now that that's tied up, and there's no twists and no twists and no folds, I'm gonna go ahead and apply the dressing now, carefully. Around like so. Okay, dressing is in place, and then I'm gonna go ahead and apply a piece of gauze to the area of where I have made the tie. And as I'm putting this gauze, I'm gonna go ahead and tape this together, but I'm not gonna touch the patient's skin at all. I'm only gonna touch the gauze to protect it. To protect this patient's skin from making any skin breakdown. Okay, now that that's taped, I'm gonna go ahead and stick 2 fingers in, and they should be able to fit freely, like so. So this is to ensure that it's not tight. And I have completed. So I'm gonna go ahead and gather up all my supplies. I am gonna go ahead and lower the bed to the lowest position, give patient the call light, see if they need anything else, thank them. I'm gonna go ahead and dispose of my gloves, hand hygiene, close the door for privacy, and document on what I have just done.